So Mob, can you tell us a little bit about what FST is all about?
So FST stands for Fascial Stretch Therapy, which just basically means you're manipulating the fascia, which surrounds your muscle mass. It's this very thin layer of cells that surround it, and we stretch it to create mobility as well as creating space between the joints and allowing synovial fluid to pass through. So it's great for increasing your range of motion, it's great for pain management, as well as for common issues like arthritis and fibromyalgia.
Awesome. So if a member has specific areas that are always getting tight when they work out, is FST something that could help them release those areas so that they're able to get more range of motion?
100%. So you'll notice with the entire movements that we do with the body, we're tractioning. So let's say Roger has a tight lateral line. The more we stretch it, we don't just push, we do little rhythms. So your body and your muscles get used to it and learn how to get to that point safely, which of course will mimic onto the gym floor with weights. You'll be able to get to a lower range and set that range with the weights that you're doing.
Great. And now you're working on Roger's lower body, but I'm assuming that it's for, all areas of the body. You can also, okay.
We usually do FST in upper body or lower body, or just injury focus. So if someone comes in with very tight hips, you can definitely focus the entire hour. Our fascia is in line, so if Roger has a problem with his upper back, it could just be that there's something wrong with his hip. If there's something wrong with his knee, it could just be there's something wrong with his ankle. So it's just finding the area of focus to make sure I work on the entire hour or just half the hour, depending. Just gonna slide this left under the straps. So I use these straps just so I can make sure that I can maneuver the body without the other leg following through. Same thing with our upper body, so just relax, get a better breathing.
And how is FST different than massage therapy?
So massage therapy, they use basically pressure points, so they'll keep pressing on a tight muscle to allow blood to flow to that area, and they kind of release knots that way. FST is something that is you kind of match with your own workouts. It makes your workouts better, which in turn prevents you from getting those muscle knots that you need to release through RMT. Another thing is FST is different than RMT, where it's a pain-free movement. So with RMT, naturally, they have to get really deep to break a muscle knot, where FST, we just focus on your breathing and seeing how far your body can take you. And we do that in segments, so every single time I'll know how far Roger was able to get, and I'm going to try to push him further.
Great. So you're working on Roger's lower body. Could what you're doing right now help somebody that has, a lot of, is prone to knee pain when doing exercise?
100%. One thing people don't understand with knee pain is they usually assume there's a problem with the knee, and most likely it isn't. It could be that your hips are too tight, that every time you walk you're causing unnecessary pressure on the knee, or your ankles are too tight and they're causing unnecessary pressure on the knee. So it helps in a way where, of course, it'll relieve the pain because we're getting to the trigger point, but it'll also help that mind-body awareness for you to feel exactly where the pain is radiating from, so you can work on it when we're on the gym floor.
Great. Now, could this also help with posture? So if somebody has a really tight thoracic spine and has a really hard time bringing weights overhead, could FST also help with that?
Of course. So part of the FST process is we take pictures before and after of your squat, which is an all-around movement, as well as an overhand reach. And the reason we do this is because we want to make sure that you see the difference that it causes, and so you work harder to make it permanent. So now when Roger squats, he's going to get a lot lower, naturally because of the space we've caused for him. But it will help him now he squats to use that new range that he has, so he can make it his new permanent range.
Okay. Awesome. Thanks, Bob.